I got my driver's license, I was asked if I wanted to become an organ donor. I initially thought that saying yes would be the obvious choice, but when the DMV clerk developed a sort of stunned look, I started second-guessing myself. I've been looking into the controversies of organ donation since then, and what I found shocked me and may do the same to you. Recently, especially in the past few years, countless news articles have been published about cases of deceased organ transplants being performed on donors who are not actually yet deceased. CNN and other news stations have reported that changes in medical policies and regulations have been called for, but are they enough? Looking to enter the medical field in the future, I've talked to doctors in shadowing and observational opportunities, and organ donation has always been a topic that comes up. I find it interesting to explore both sides of the debate, and I finally come to a conclusion. Becoming an organ donor is certainly a noble choice, but it should be given some serious thought. Organ donations from the deceased is ethically dicey, as shown by recent news, and it can be ineffective for the recipient. So, when possible, live donations are less likely to end in malpractice, safer for both parties, and are more well received by the patient. In general, deceased organ donations can be an ethical minefield, which can make live donations more desirable. Deceased organ donations are ones that involve organs which have been harvested from recently dead donors. Live donations are, as they sound, when live people donate sections of their organs. Many articles have come out recently, like a 2024 NPR article about organ removal policy violations in Kentucky especially, that suggests donors are being taken off life support prematurely. Almost a year ago, T.J. Hoover was brought into the operating room for a deceased organ donation, but he awoke during surgery. The man was brought into surgery after being declared brain dead, but he was showing enough signs of life to call for the surgery to be canceled. He thrashed on the operating table until he was released. He and many like him are taken off life support before they prove to be brain dead enough for surgery. Live donations avoid these ethical complications entirely because the patient is awake to consent to the surgery. From a University Health article, being brain dead or having circulatory death where the heart stops are not the same as being dead, though patients in these states undergo organ removal surgery as if they are. Generally, a patient's heart must be stopped for at least 5 minutes to be declared dead, as reflected by guidelines from the South Carolina Medical Association and others. However, there are reports of hospitals in Kentucky, especially rural ones, that don't follow this rule as closely as they should. In addition to more straightforward doctor-patient interactions, live donations can be safer for the recipient, and they aren't very hard on the donor. Recipients of live organ donations often live longer than those of deceased organ donations. According to a PBS report, patients who receive live organ donations have a 90% 10-year survival rate on average, whereas that number drops to 75% for recipients of deceased organ donations. The rate of deaths for live organ donors, especially kidney donors, has been steadily declining over the past few decades. Of over 164,000 live kidney donors since 1993, only 36 were found to have died of surgery-related complications, according to a study done by a group of New York students, reported by a Penn State article. Live organ donations are far more effective and beneficial than deceased donations. Organ donations from live donors, when possible, are ideal for both the donor and the organ recipient. Living donors can only donate one kidney and small portions of other organs, including the liver, lung, pancreas, and intestine. But these small sacrifices have huge benefits. Because they must keep enough of their organs to stay alive, donors have to be conservative with how much they remove, but even the small donations can lengthen a recipient's life by twice as much as a full organ from a deceased donor. Live organ donations reduce wait time. Only 1% of people can donate organs following their death due to complications and bodily damage. However, because live donors are much more likely to have healthy organs, they can be removed and transplanted quicker and on a larger scale, bringing organs to more people in need than deceased donations. Compared to deceased organ donations, live donations are ethically more straightforward, safer, and will be more beneficial for the recipient. Donating organs is undeniably selfless, but for your own sake, it may be safer to do it as a live donor than posthumously. The next time you're thinking of becoming an organ donor, be sure to consider both sides, and if possible, do it while you're still breathing.